Facelifts is an operation that's aimed at gravitational aging in the face. Our skin ages. We have sun damage, which causes a certain amount of aging, spots, fine lines, and wrinkles. Then we have gravitational aging, and that causes heaviness in the area of the jowls, laxity in the neck. And in those cases, a facelift is the best way to restore or lift those tissues back up into their previous position. A facelift, to some, it will incorporate the neck at the same time as we do the face, or you can just sort of do the upper face. We are gradually migrating toward a short scar facelift, and the purpose of this is just to have a limited incision and a limited scar, and then to try and get a maximum amount of pull. Through that limited incision facelift, frequently you can get a very, very nice result, much less of a scar, a little less downtime than we get with a normal facelift, and a very nice tightening of the neck and jowl area. On those patients that have a lot of excess skin, it's impossible to limit the length of that scar. In those patients, we need to extend the scar so that we can remove the excess skin that is there. And in that case, of course, it would dictate to have a longer line. Facelifts can be done under either local or general anesthesia. I leave this solely up to the patient. I think that you can get a nice result, doing it in either way. Perhaps the advantage of a local anesthesia, if you're never asleep, you really never have to wake up, so you don't wake up with pain or misery or any other problems. But some of the patients prefer to be asleep, which is also okay. The recovery time is actually much quicker than anyone wants to think. Most people are surprised at how easy it was to go through the procedure, and can't believe how quickly and how well they heal. There's always a little tightening underneath the deep layer of skin, and that excess tightness will make it sort of difficult to turn and move the head. Most people will adapt to that at, say, 2 to 3 weeks, and then usually by 6 weeks or 8 weeks that is beginning to get lax. And it's important to have those deep layers tight because that's going to ultimately dictate the end result of the facelift.